Okay, and so we are live here. Welcome, welcome. And so it is another lunch session that we're going to be doing today. And pretty much it's a standard thing. I know I've been gone for a while, and the reason I was gone was because I was on vacation, and I was on a family vacation. We went to Iceland, and so we went to Iceland for like 10 days, I think, from like last Friday to yesterday. So I guess that would be, but then I left there's not, yeah, 9, 10 days that we went on vacation for. And yeah, pretty much just saw all the beautiful sights of Iceland. And yeah, so that's why I didn't really get a chance to go live much. The internet was spotty. We were traveling a whole bunch around. And so that's why I didn't get the chance to go live at all. But at least we had a bunch of content prepared that we could still pump out content while I wasn't around. But now we're back. The standard routine is going to start and keep going. And so that's what's going to be our goal. Let's see, other things that I really want to do. I'm going to be working on my program, the coaching program more. I was going to develop a module on nutrition. That was my goal, actually, was to develop a nutrition module, teaching people, okay, look, this is how you like put on weight, this is how you lose weight, this is the basic of nutrition, like these are fats, proteins, carbohydrates, etc. Because people got to know this stuff. Like a lot of healthcare providers don't really understand that much about nutrition, just because they were never taught it. And so that's something that I want to include for sure. So yes, Iceland was amazing. Honestly, like there's no bad views in Iceland. That's the saying that I kept saying over and over. Like there are literally zero bad views because everywhere you look is like a nice thing, whether it's a hill, a mountain, sheep, horses, glaciers, like literally every drive around every corner there's something new. So yeah, just incredible, great experience overall. Hope you're having a great day. I am, yes. So I'm just getting back into my routine. I landed late last night, and so pretty much just came home, unpacked, and went to bed. Like that was it. So today's been the full like back to work kind of day. Yeah, went to the hot springs, went to Blue Lagoon, went to a different hot springs as well. So yeah, just a really cool experience overall. Agreed, most doctors I meet don't know it. Yeah, it's just because we're never taught nutrition. Like, no one understands, okay, this is a carbohydrate, this is a protein, this is a fat. Okay, if you want to gain weight, you have to eat more calories than you burn. If you want to lose weight, you have to eat less calories. Some foods are more filling than others, so it's better to eat more filling foods. Protein is very filling. Weight training helps boost muscle, and increased muscle helps to boost your metabolic rate. Stuff like that. Stuff that I now know for granted, but a lot of people don't. So why don't we go through everything? So Millie asks us, I have started with escitalopram, 10 milligrams, I assume, and now I have 20 for my anxiety. Yeah, that's pretty standard. Yeah, I wouldn't think too hard on that. That's very standard to start with 10 and then go to 20. Sometimes I've gone to 30 for severe cases, but usually 20 is a good, consistent dose for a lot of people. Where are my scissors at? Yeah, 20 tends to be a pretty consistent dose for many people. Okay, Elani says, is adding Vyvanse 30 milligrams to Lamictal 120 milligrams fluoxetine stimulating for the heart? Yeah, the Vyvanse can be stimulating for the heart. So that's why ideally you don't want to go too high. But the others aren't really heart stimulating. Hi, thoughts on mirtazapine? So mirtazapine is really good. I use it a lot. Primarily for people who need to either they have depression problems, they need to gain weight, I'll use it, or if they need to have trouble sleeping, then I'll use it as well too. Those are the main cases that I would use mirtazapine in. Okay, let me get 2 pieces of chicken there. Can I private message you? You seem really good. Yeah, so the best way to work with me is to book a consult. So if you're a patient, you can look in my description and you can see how to book a patient consult. And that's the best way to book a consult with me if you want any kind of personal medical question answered. All right, where are the goggles? So the goggles are here for sure. They were falling off my face though, so that's why I had to put them back. But they're here. They are here. And also I started following Chat's advice where I defrost my salmon the night before. So I find that the seasoning sticks on better. So I'm thawing it under the refrigerator. Why does quetiapine make me fat? So quetiapine, it does a couple things. It increases weight appetite through specific hormones like ghrelin. And so because of that appetite increase, it makes people more hungry. And then also I think it affects metabolism as well too. It decreases the metabolism of people. And so those are the 2 reasons why it causes weight gain. So you just have to be very mindful of your diet and what you eat with quetiapine. Like that's why, like eating foods like this, like high protein and veggies, are going to be really helpful to prevent weight gain on quetiapine, because then at least you're eating at a low calorie amount. What can trigger my mania in bipolar? So a couple things. The biggest one is sleep deprivation. That's the biggest one by far. If you're getting sleep deprived, then that is a huge trigger for bipolar. Another one is alcohol or substances. Any kind of substance can also trigger a bipolar episode as well. So you just want to be careful with any recreational substances that you partake in, because it can trigger that. So I've seen patients who have been triggered by alcohol, for example. Stress can be another big trigger as well. Caffeine's another trigger. I had a patient who stopped her meds and she started taking a whole bunch of Red Bull and caffeine to stay up all night. So that was a multi-trigger because she was staying up all night and she was pounding a bunch of caffeine and she'd gotten off her mood stabilizing meds. So all of those were triggers for her. What do you think of a combination of citalopram, risperidone, and quetiapine? I like quetiapine a lot for CPTSD. I used to use it a lot with my VA patients when I worked at the VA. I don't know why you would combine risperidone and quetiapine, maybe for agitation or something, but other than that, I'm not sure what the rationale would be for combining the 2. A patient on 100 milligrams of Seroquel and 50 milligrams of Zyprexa, psychosis and hallucinations again. I'm just wondering, why would they be on a little bit of Seroquel and Zyprexa too? I guess the 100 milligrams of Seroquel is for sleep, but I personally don't like polypharmacy unless there's a big reason for it. So I don't like combining 2 meds of the same class. I would rather optimize one med of the same class. So for example, if I have a Zyprexa and Seroquel, I'd rather optimize Zyprexa first. Especially if I'm trying to target, psychosis or sleep. But in that case, using Seroquel and Zyprexa is acceptable if the Seroquel is mainly for sleep targeting, but then also you get a little bit of side antipsychotic benefit too. So yeah, having So that's what I coach in my academy as well, like my nurse practitioner academy, is that having a clear rationale for why you do things, like why you make a clinical decision and what goal you have, is super, super important. Because if you don't have that, then you can kind of get lost and you go with like patient whims, or you can go with like, for example, you see a patient on benzos and stimulants and other stuff, right? They might have a complex regimen and you may not be sure where you want to treat things. So having a clear goal of what you want to accomplish. For example, like one of my students told me that she had a patient who was on benzos and stimulants, but they also had anxiety. And so in her case, and ADHD. So, what I told her was, okay, figure out what you want to target first, what the patient wants to target. And the patient wanted to target anxiety. So I was like, okay, great. If we know the patient wants to target anxiety, then let's focus on that. Like, let's not focus so much on trying to come down on benzos or trying to remove stimulants if anxiety is our target focus. And then you can always adjust later on as you need to. So yeah, that's an advice I give to providers, is having a target is super important. So yeah, out of curiosity, who here is a provider and who here is a patient? Okay, perfect. Well, at least the salmon and the chicken have been put in the oven, so now they're cooking. I'm gonna give them about 20 or so minutes to do that. This will go here. Black pepper can go there. Go there. That I need to pack up. Physician here, patient, provider, MD, PhD, provider. Okay, looks like we got a good mix here. So yeah, why don't we do one if you are a NP provider, do two if you're a physician provider, and do three if you're a patient. Yeah, how about that? Do you have anxiety? I do not. No, I've never really struggled with anxiety personally. I mean, some social anxiety stuff, sure, I've had, but yeah. Like, the main social anxiety things were younger. Oh, let me set the timer before I forget, and I keep on yapping. My main social anxiety was younger, when I was around not around patients, in my in college and high school. I wanted to be cool and social and popular, and so I had a lot of anxiety around people who weren't like nerds, quote unquote, meaning like girls and popular kids and stuff. So that's the main social anxiety I have. But eventually I joined a fraternity, and that really helped me to overcome it just by giving exposure. Can you give me tips on how to prepare for the PMHP board exam? So I'm not sure how to prepare for the board exam personally, because I've never taken it. Like, I've taken the medical board exams. I've never taken NP board exams. But a good place to ask would be to ask in our community. So I have a PMHP community that I run. And so that would be a good place to ask. And then, other NPs could be able to give you some good advice on that. So some of my other students, because some of them are in PMHNP school, others have just graduated, and others have been practicing for a while. So that would be a good place to ask. And so if you're curious about that, the best place to do that is, the best place to check that out is in my bio. How old are you? Guess. Well, how old do I look? That would be the guess. I'm just curious what people say. Curious about escitalopram plus clorazepam versus alprazolam and clonazepam. Past history of epilepsy. I'm not sure what clorazepam is. Is that an anti-epileptic? I'm gonna look that up. Clorazepam. Because I don't think we use that in the U.S. Is it? Oh, it's a benzo. Okay, I see. I see. I've never used that one personally, but yeah, you can combine SSRIs plus benzos together, um, versus alprazolam. So I'm basically the way that I try to decide benzos is the half life. So alprazolam has a short half life. Alprazolam or Xanax. Lorazepam or Ativan has a medium half life, and clonazepam and Klonopin or Valium, they have long half-lives. So depending on the duration of action that I want, that's how I decide which benzo to use. So for example, for like just like a short-lived panic attack, I like Xanax or Valium just because they hit the quickest, but Xanax doesn't last that long and Valium lasts a while. So then if the anxiety is more persistent, then I'll use Valium, whereas if it doesn't last that long, then I'll use Xanax. Yeah, if it doesn't last as long, then I'll use Xanax. Ativan, I'll use more for agitation, like let's say in the hospital, because it lasts a decent amount of time. It hits pretty quickly. There's a lot of evidence for it. So that's what I prefer for agitation, and just something if I need it a little bit longer. And then if I need something that's more like covering throughout the day, like a generalized anxiety, that's when I might use clonazepam. Also, please do not spam, because then yeah, you obscure other people's questions too. And so it's just bad etiquette to also be spamming. You know, if you want to, if you want your question to be seen, best way to do that is to subscribe, because then once you sub, then your questions will stand out more than everyone else's. Omega says, do you support Seroquel for off-label use? Why? I use Seroquel for off-label use a lot for sleep sometimes, especially if there's any kind of mood disorder. I wouldn't use it just normally, but only if there's a comorbid mood disorder that I'll use Seroquel. Or if there's like some anxiety that I'm trying to address. For example, I had a PTSD patient who I used 100 milligrams of Seroquel with, and that really helped him because it helped him sleep, but also gave some mood stabilizing as well. If I had a choice between blunting my Ritalin, should I go with Ritalin plus Depakote versus Ritalin plus Effexor? Well, Depakote and Effexor target different things. So, Depakote is more Valpro. It's more for bipolar stability, and Effexor is more for like a depression, anxiety, and if it's bipolar depression. So it really depends what you're trying to target with those two things. Any advice to stop balding early? Yeah, so I take finasteride, I take minoxidil. Yeah, I use the creams as well as the orals. I got a hair transplant, so I've pretty much done a lot of that stuff. So that's what I would say. Do you see long-term mental health issues after Accutane use? I've never used Accutane personally, so I don't know. I've never really seen it either. Is functional neurological disorder something you can talk about? Yeah, so I remember I had a patient who was she was like a 16, 17-year-old girl. She was in the inpatient unit. She had FND. She would have these seizure episodes, and it turned out, and they were not true seizure. Like she had been to the seen neurologist, got a epilepsy or got a EEG done, and so she had an episode with the EEG, and it was not epileptic. And so her case ended up being a lot of anxiety. There's a lot of patient or parent fighting, like divorce stuff that was happening. So when we treated her anxiety, her FND seizure episodes got a lot better. Go to Turkey. Yeah, I went to India. That's where I did mine. What to do if you get anxious talking to others and in public all of a sudden? Yeah, so oftentimes what you have to do is you have to stick it out, because if you think about it, panic attacks and other things and anxiety, they cause us to avoid situations. But then when you avoid the situation, what you're doing is you're telling yourself that, hey, this situation is too stressful, I need to avoid it. So imagine if you have a fear of heights. The way you would conquer that fear of heights is like you would go to the first floor, then you go to the second floor, then you go to the third floor, and then you go onto the balcony, then you equilibrate or get into equilibrium with every single stage. So that's the key. So it's the same thing with social anxiety too. You start small in social situations, then you build up over time. And then, when you conquer those situations, you tell yourself that, hey, I'm able to get through it. Awesome. Virginia, thank you for the sub. A transplant. I'm from Turkey. Yeah, so I got my sub in India instead of Turkey, because I was traveling to India, but same thing. Skincare doctor. No, I'm a psychiatrist, not skincare. What med can you recommend in pregnancy to be safe? I mean, it depends on what you're treating, right? But generally, Zola SSRIs are pretty safe in pregnancy. I also did a recent episode with Dr. Kristen Thompson. She is a psychiatrist who specializes in women's mental health. So you can check that out on YouTube as well. Kristen Thompson. Do you think FND and somatic symptom disorder can co-occur then? Yeah, of course, they're different things. FND is like neurologic symptoms that come up in response to psychological distress. Somatic symptoms are stuff like non-neurologic, like stomach pains and arm pain. Stomach pain, the GI ones are the most common ones by far. Got spooked by talking to a psychiatrist. I have trauma bond to my therapist and nervous to share. Yeah, that's something that comes with time. You have to be able to share your stuff with time. And like also by establishing a level of trust with the provider too, right? It goes both ways. All right, yeah, let me see who with the audience breakdown right now. It's like who is provider versus patient. Oh man, the chat is going. 35. Oh yeah, the age. I'm actually 21 or 31, sorry, but I'm about to be 32 next week. 3. So it looks like we have a couple providers and some patients here. So good mix. Yeah. Yeah. Out of curiosity, what's the reason that you watch these lives or follow this channel? Like, is it for education? Is it for to feel like alone, not supported? Is it to connect with other providers? Just out of curiosity. Any tips for... Okay, let me check how much time. Okay, we got 12 minutes in the timer. Do you think we're ever going to have mental health meds with no side effects? I don't think so. So all medications have side effects and problems, and the way I think about it is like, and this is what I tell my students in my coaching academy too, is every medication has both benefits as well as risks, and what we're trying to do is you're just trying to balance out the benefits while eliminating the risks as much as possible. Like that's the only goal that we have. So what we want to do with all meds is just try to optimize the benefits while reducing the side effects. How sustainable is California rocket fuel? Is it only a year or two before it stops working? Yeah, so California rocket fuel, that is venlafaxine plus mirtazapine, and it has that name because it does it helps people sleep, but it's very stimulating too. So there's norepinephrine with the venlafaxine, but then the mirtazapine can be sedating, so they can counteract each other in a way. And they both hit serotonin receptors differently, so they both and so they hit differently, so that's why you can stack them together. It tends to be very effective for treatment-resistant depression. Education, nice education. I'm a paramedic. I need help with an actual psych education support. Okay, that's very helpful. Thank you. Yeah, just out of curiosity, who is a provider or let's say an NP who's looking for education? Like, you feel like you just haven't learned enough, or you feel like the real world doesn't teach you as much, or like school didn't teach you as much. Because like that's something that I feel like my channel has evolved into, is teaching and educating other providers, because I've had so many people who've said that, hey, my school never taught me, hey, NP school never taught me, my residency was not very helpful, my workplace, my collaborator, my supervisor doesn't really teach me. So that's what I've come to realize, that a lot of people didn't get the education from their, like, real educational experiences, like school, for example. And so that's why I started doing this, to fill in the gaps. And a lot of patients don't know a lot of the stuff either, because their docs don't explain it to them, or the providers don't explain it, or just quite frankly, it's confusing, and they see a lot of just scary stuff on the internet, so they want real info. Thoughts on taking Depakote for epigenetic reversing properties? I'm not aware of that at all. So I'm not saying it's not a thing, it's just I'm not aware of that. Many PSSD were cured using it. Yeah, I'm just not aware of that. What can I take for olanzapine weight gain? Yes, I have a couple patients who I'm treating with this, for this. So for olanzapine weight gain, for example, I'm using a metformin, GLP-1 agonist, diet changes, right? Making sure you're eating clean, unprocessed diets. Vyvanse I've used before as well, especially to address comorbid ADHD. But usually metformin is a good place to start because it's cheap and tends to be covered very well. Some appetite suppressants can be helpful too, like green tea extract, caffeine, etc. Gluten and schizophrenia related. So I believe that it's not necessarily gluten that causes it, but rather just high inflammatory stuff. I'm a big believer that high inflammation can worsen mental health conditions, depression, anxiety, and schizophrenia too. They found that the ketogenic diet has been helpful for treating schizophrenia symptoms. So by that regard, having a more carbohydrate-based diet, I could see worsening schizophrenia symptoms. I personally feel that most carbohydrates are inflammatory. Like, I feel worse when I eat them, and I've had patients feel the same way. Not like veggies, but stuff like pastries, muffins, cakes, etc., etc. Like, you just don't feel good and satisfied long term. So I've shifted my diet to be more of a protein, paleo, carb-based or veggie-based diet, like meat, veggies, Greek yogurt, like that type of thing. And I've noticed that I feel the best mentally with it. I watched for my husband who has the PMHP. Nice. I will be graduating in October. Nice, nice. Ooh, let me get my, I have a shawarma from yesterday, because I was traveling yesterday, and that was my pre-workout, not my pre-airport meal. And I finished like half of it, so I just need to finish the other half today. Can I take both fluoxetine and ADHD medication at the same time? Yeah, you can. It's very, very common. Not a concern at all. This is definitely not going to look appealing or appetizing, but, fuck it. I am going to eat this. And this is not, I don't normally eat this kind of stuff. Like, at home, I never do. It's just when I was traveling, that's what's available. So that's what you have to do with it. If you do eat breads and stuff, you make sure they're whole wheat and not white bread. Love that explanation about food. I appreciate it. Yeah. And so I was just saying that in my PMHNP program, that's something I want to incorporate more is nutrition content. So I'm going to be recording a module on because people don't really understand about nutrition. It's not something that's taught to medical professionals, believe it or not. Like, I learned all this stuff on my own. So I'm going to be teaching, how to gain weight, how to lose weight, difference between carbohydrates, proteins, fats, how to put on muscle, how patients can lose weight, how they can combat hunger, cravings, that kind of thing. So I'm going to make a whole video on that, so that way other providers can be educated. So that's going to be in my coaching program. So let me pin And you can definitely ask me about this stuff too. If that, you can just send me a message if that interests you. If you're an NP who wants to learn more psychiatry, and you want to learn the stuff from a psychiatrist, and you're tired of not feeling confident in psych skills, and feeling like people aren't really teaching you, collaborators aren't teaching you, preceptors aren't teaching you. That's the whole reason I started the program, just because I was running into, like, people were saying that, hey, I'm not getting taught, and I was like, okay, someone needs to change this. Is it normal for olanzapine to cause low blood sugar all the time? Normally it would cause more high blood sugar, but your natural body's insulin could be like overcompensating. How long do brain saps last with coming off Lexapro? I was on it for 2 years. I mean, it shouldn't last that long. Uh, I've had some patients who've had it maybe for like a month or so, but generally the way, if you want to lessen the withdrawal that can come from like SSRI withdrawal, like brain zaps, for example, you just have to slow down the taper. So for example, if you go from Lexapro's 20 to like 0, then you're gonna have a big, like if you go from 20 milligrams to 0, then you might have some withdrawal. But if you go from 20 to 15 to 10 to 5 to 0, and you do it slowly, like over the case of a couple months, then the brain zaps should be less. Oops, I forgot to weigh it too. Sometimes I'll weigh my food just to get back on the routine of my diet. And since I was traveling for the last 10 days, I was eating a lot of snacks and stuff. So now I need to... Okay, so that's 637. Let's tear that. It's about 200 grams of chef shawarma. So yeah, I like to measure my food that I eat. And that way I know exactly how many calories, protein, carbs, etc. I'm consuming. And on vacation, like generally, I'll be more loose about it. But then when I resume my regular diet, I like to be more streamlined with it and more on the ball, because then I can really keep track of what I'm eating, and that way I can manage my body and make sure that I maintain the physique that I want. Have you had experience with a patient who had rash and hives from Wellbutrin? I mean, I've never had that experience personally, but I mean, I know people certainly have that issue. But I've never run into patients who have had skin issues from Wellbutrin. Mainly I've seen agitation and sleep issues. Those are the most common ones I see by far. So actually, this is probably the best spot for it. You also have seizure. I don't have. Where am I based? Well, guess where I am based on my aesthetic here. Have you heard of PSSD? Yes, I have. If you check out my podcast I did with Dr. Yosef on YouTube, he runs a channel called Taper Clinic. He talks a lot about this. That's where you can see my talk on that. Nope. Yeah, it's New York. Yeah, it was always my dream to live in a big city. And I moved to New York about 3 years ago. I came here for my child and adolescent fellowship. And then just, never looked back. I wanted to match at Langone, got Stanford instead. Okay, humble flex. Like, New York is not cheap. No, it is not cheap for sure. But there's a lot of opportunity here. There's a lot of growth opportunities in New York that are only in New York. You know, like networking, people that you can meet. Like all my friends are so diverse here. Like I have friends who are in the fashion industry, modeling industry, photography industry, acting, movies, producers, like medical friends, AI friends, tech friends. Whereas in a smaller town, all my friends were just like mainly like medical or like doing random stuff. So just the level of people and the stuff they're doing is really cool in New York. Started a new job. I'm the only one holding a senior position in the team. I see. What kind of job is this? Like a provider job, like an NP job or something? I don't understand how you can book for patients through TikTok. I'm not sure how you don't understand. Like I just have a link and people see the link and they'll click it and they'll book it, you know? And the reason I like social media so much is because patients can really see who I am. They can talk to me. Like it's not just like a photo on a website. You know, you can literally see me talking right now. Like this shit's live. So if you feel like you'd vibe well with me, then you can book a consult, right? And if you don't, then you just keep on scrolling. How can I get on an ADHD med while having anxiety? Two ways. Either one, treat the anxiety first, or two, use like a non-stimulant like Strattera, which can also address anxiety. How do you feel about neuropsychiatry? I'm not too familiar with it. I'm not sure like what that means exactly. Like, is that referring to more seizures? Like, is that referring to like EEG stuff? Is that referring to like neuropsychological testing? The field hasn't developed as far enough to be able to use things like neurotechnologies. Unfortunately, we don't really use it for diagnosis. Primarily US-based patients, but I have done some consults before for patients who are, for just people who are outside that, like clients who are outside that. And usually I won't do the prescribing, but someone else will do the prescribing, like a PCP, like the person's PCP, for example. I can just give some guidance for international patients. Hi, I was wondering if you could go back, would you still choose MD? And how is telemedicine psych? If I could go back, I probably wouldn't do medicine. I would be a YouTuber. Like I like doing social media, so I would have just rather done it directly rather than gone through the whole medical journey first. But if I had to do a medical thing, then yeah, I would still choose to do an MD over anything else. Just because I wanted the additional training, like I wanted to be the best. And so I knew that like I had to get the most level of education possible. Would you recommend studying psychology? You can study whatever you want to. I assume you mean to get into med school and stuff, right? Like, yeah, you can study whatever you want. And that's the nice part. I had classmates who were business majors. I had classmates who were, like one lady she was 36 years old, she was a pharmacist. I had a couple art major classmates and everyone passed and they got through their exams. MD is master's, no, MD is like a medical degree, like a medical doctorate. Do you get approached by big pharma to prescribe their medications? Yeah, they give us talks and stuff to educate, but they don't pay us any money to prescribe. Like I don't make any more money if I choose like a newer pharma medication over like an older medication. That's why I like using the older meds more, the generics more, just because they're cheaper for patients. But okay, looks like our food is here. So my eating strategy is unique. I only eat once a day, so I try to just have my full like day's calories in one sitting. That's just how I like to do it. But yeah, and I try to make it mainly protein and vegetable focused. I'm gonna put that there. Excuse me. Oof, you need to move. And then you need to move. Are you Arabian? I'm not Arabian, no. Also, definitely, if you like this, definitely click, if you double tap the live, and if you double tap it, then, yeah, it helps spread it helps spread the live to the algorithm. So thank you for doing that. Just double tap it to like it. I didn't even know that was a thing, honestly. I just found out recently. Does Raylar cause weight gain? I mean, it can, but it's on the lower end. So that's the nice benefit about Raylar. So, would you ever go to swim with the Colombian girl? I don't know what that means. What do you mean go to swim with the Colombian girl? Is that a euphemism for something, or yeah, I don't know. Old gen drugs are hideous. I mean, the new gen drugs have problems too. It's not like they're magic. Because if they were like so much better than the old stuff, then everyone would be using them, but they're not. Oh, let me turn off the oven there. We also put a bunch of seasoning on. That way they can at least cook. I found that with the broccoli, I can't really put on the seasoning beforehand. Especially if I do it frozen, because it doesn't stick. But if I do it now, and then I just let it cook for a bit, it works out pretty well. You know deep down, I don't know what deep down. No more. Is psychiatrist nurse good as a psychiatrist? They're just different, right? A psychiatric nurse will be addressing stuff from the front lines, whereas a psychiatrist gives more of the orders. Okay, like here's the medications I recommend, here's the therapy I recommend, overseeing the patient's treatment, etc. It's kind of like a pilot and a flight attendant. Like that's sort of what the relationship is like. Do you think it's hard to treat behavioral issues when it's an uncontrolled adrenal disease? Yeah, of course. That's why, the psychiatrist expertise is in medicine. Like we are doctors first before we become psychiatrists. And the reason is that way, if the patient has medical issues, then I'm able to see them, identify them, and either treat them or be able to recommend treatment. So for example, one of my patients has uncontrolled hyperthyroidism. So if they have uncontrolled hypothyroidism, then they need endocrinologists to manage that. And so I was able to identify and test for the hypothyroidism. So that way I knew to recommend to an endocrinologist. All right, now we got lunch going. I want to get a consultation from a psychiatrist, but I'm afraid. Nothing to really be afraid of. So something that you could do is actually do a short-term consultation. For example, instead of like the full 90 minutes, you do one for like 10, 15 minutes. For example, like the one that I offer is only 15 minutes. So that way you can kind of get a feel for the psych and see if you guys are a good fit and if they're a good fit to help you with your issues. That looks so good. And just order a pizza. Hey, no judgment. I was just traveling for the last 10 days. I was in Iceland. I went on a family vacation. So there I was eating a lot of snacks and like, nuts and Icelandic chocolate and stuff. So yeah, no judgment. But now, especially now that I'm back home, I have to get back on my normal routine diet. So that's what I'm doing, getting back into reality. If you choose to be a YouTube over medicine, what will your channel be about? So if I could do it again, I'd probably become a YouTuber right after college. And like assuming I went to college, and I would talk about college issues, confidence, self-esteem, that type of thing. Like that's what I would talk about. How to survive college, maybe study tips. How to boost confidence, that type of thing. Self-improvement, basically. That's what I would do if I could redo it again and start over. How was your weekend? It was good. Yesterday was a flying day for me. So I was in Iceland over the weekend, or over the last week, and I just flew back last night. What's breakfast? Is that all salmon? Yeah. So I pretty much eat one meal a day. So this is my first meal of the day. So I like to eat all my calories at one sitting. I was wondering where you've been. Yeah, like I was traveling around and and yeah, it was a family vacation, so the internet wasn't that good, especially traveling around the country. I mean, it's a beautiful country, but the internet's not that good. I mean, it's decent, but it's not the best. So yeah, I didn't really get a chance. Do you not get hungry later? No, it keeps me going. Human beings are designed to fast. Remember, our ancestors, they would hunt, feast, and then fast until their next meal. So our bodies are designed to fast. How to lose weight on Seroquel? I'm on 200 milligrams. Yeah, so you don't really need to lose or switch to Vraylar necessarily to lose weight. That could definitely help. Don't get me wrong, it could definitely help, but you don't need to do it. I would say just eat like this, like eating lower calorie, highly dense proteins. For example, this piece of fish is like 300 calories, whereas like 2 cookies, 2 Oreos is also like a couple Oreos is 300 calories too. So you pretty much choose choose like the higher density calories, basically. You choose the calories that are more filling for you. That's really the best way to lose weight. So like, for example, eating salmon, chicken, veggies, that will help you lose weight much more than eating a carb-based diet, because carbs break down in the body faster than proteins and fats do. How often do you eat salmon? I eat it every day. It's got really good omega-3s. I get the frozen salmon from Costco, and then I'll just season it and eat that. Hi, if I'm scared of my next surgery, can I ask for Xanax to calm me? I mean, yeah, you could ask your doctor for it. Sometimes meds can be contraindicated with surgery, meaning that it can affect the surgery and the anesthesia and stuff. So I would talk to your anesthesiologist or surgeon or whatever. But that's a common thing. They might give you that in the hospital. Or if it's an outpatient surgery, then yeah, just talk to your doc about it. Depends. Do you parasite cleanse? I've never done a parasite cleanse per se, but I do like to cleanse after vacations. And like this is the way I do it, is through diet and sleep. Like going back to my healthy routine diet, is cutting out processed foods. Yeah, you can definitely lose weight on Seroquel by being in a calorie deficit, it slows your metabolism, but it doesn't change fundamental thermodynamics. So your calorie deficit might be a little bit slower or a little bit less, but it doesn't change the fact that a calorie deficit regardless will still help you lose weight. Do you have to gain weight on Abilify? It can happen. It's one of the less likely antipsychotics to cause weight gain, but it can happen. It definitely is a thing. Skincare routine. Yeah, so for me, I consider the fundamentals of skincare good sleep, low toxins, and good nutrition. That's like the fundamentals. Hydrating, eating, drinking a lot of water. But on top of that, I do sunscreen every day. I cleanse twice a day, sunscreen in the mornings, and then retinol at night. Abilify had a somewhat stimulating experience. Yeah, Abilify is a stimulating antipsychotic. That's why I recommend patients and to take it in the morning, and I recommend providers prescribe it for the mornings because it tends to be stimulating. Just switched to night shift.